So quick thoughts on the budget. There's some positive news in there in that they have announced new pots of funding for family medicine and funding in the physician services budget. So one number we saw was $475 million dedicated to family medicine and rural generalists and primary care. And the other number we saw was about $500 million increase into the physician services budget. So trying to figure out the specifics of how that's going to play out. Is there overlap between them? And where is that funding going to go is going to be the critical next steps to take. But one thing very positive is after the budget announcement, I had the opportunity to speak directly with the Minister of Health, and Minister LaGrange has given me her word and her assurance that she's committed to moving toward the new funding model for family medicine as soon and as quickly as possible, and to ensure that when we do that, we can make Alberta competitive for family medicine and rural generalists in our province once again, so that we actually can compete with our neighboring provinces and have a funding model that will make family medicine practices viable again across the province. It was very reassuring to hear the minister say that she's committed to this and that she's going to work forward now that there's money in the budget that's dedicated that can be used to work forward to locking this down, getting the new funding model done ASAP, and then, like I said, getting an environment now in Alberta where we're competitive again for family medicine and rural generalists. And that will allow us then to now look and be able to move and work collaboratively on some of the other big pieces in the healthcare system that we know need to be addressed, specifically on the specialists and the acute care side as well. So without knowing the details and all the specifics right now of this budget announcement, I think that commitment from the minister was a positive, and as we learn more details, we'll update further.